Facelifting, okay? I look at facelifting as basically, I'm gonna define it as a rejuvenation process or procedure from here down to here. This is what it targets, the middle and lower 1/3 of the face. We can define it mini lift, full lift, this lift, that lift. In my hands, basically what I see is we have to rejuvenate these areas. And what are the target things that we need to do? Number one, this fat pad ends up coming back down here. So as in the natural aging process, you look at a nice, cute little 3-year-old kid with nice cherubic cheeks, okay? And then what happens is those cheek pads start coming down, you get the little fullness right in here instead of way up here. As that comes down a little bit further, you see the little marionette lines and the pre-jowl sulcus that kind of comes in here with a deepened melolabial fold. This is kind of the aging process that happens up in this area. Then in this area, we just talked about what happens in terms of laxity. We lose laxity. This starts coming down. You got a little bit of a gobbler action happening here. This is what we've got to target. We need to put this fat pad back up. We got to lift this back up, sharpen the jawline, soften this line, and sharpen the neck. Those are the 3 things we need to do. 1, 2, 3. So depending on what the patient needs, we pick these type of techniques in lifting to get those results. So in my hands, this is what I end up doing. So first thing I end up doing is basically lifting that pad up. So basically that's kind of a modified mid-face lift. So it gives the patient a kind of a more cherubic cheek, takes this fullness out of here, brings it back up to where it used to be, softens this line, and I'm using my word very carefully, not erases, softens this line, sharpens the jawline, takes this almost 90% away, and sharpens the neck.